All right, shall we proceed to the area plan?
All right, so what I'm seeing on the screen here is not what I'm seeing on my laptop. So I'm going to attempt this sharing, presenting in Teams, and we'll see how this goes. And not that we keep it on it. Okay, so are you guys seeing my screen okay? Are you seeing just the slides, or are you seeing like what are you guys seeing?
People
We can see
online.
the slides. We can see the slides online, Helen.
Okay, thank you, Michelle. I appreciate that. All right, good morning, everyone. So this presentation is going to serve as our public hearing for the area plan for the federal fiscal year 2026 Agency on Aging budget. Okay. This is the first time we've done this as an official public hearing, and so please bear with me. And so anyway, we're going to go ahead and get started here. So just a little background, we're going to start with agencies on aging. And so area agencies on aging are part of what's known as the aging network across the country. We are one of 622 or something like that agencies on aging across the country. Every community across the country has an agency on aging. And so, but I don't think there are any two agencies on aging that are the same, because we are charged with serving our community, right? Tailoring the services that are available to the needs of our local community. So there are 5 core services that we all offer, and those include nutrition, supportive services, caregiver services, health and wellness, and elder rights. Okay. And all AAAs assess their community needs, provide education to the consumers about resources in the communities. We serve as portals to care. So we perform assessments, we determine eligibility for services, and we do care coordination. We try to maximize the use of public and private funding to serve as many people as possible. And we develop, fund, and coordinate a wide variety of services. And we'll get into that a little bit later in the slides. Okay, and so in Virginia, there are 25 area agencies on aging, and the map to the right is the breakup of those agencies, and the ones in Northern Virginia are known as the 8s. They are the 8s because originally we were one agency on aging in Northern Virginia, and then it was broken up to each of the different counties. And so, so that's why we call ourselves the grade 8s up here. Anyway, DARS, the Department for Aging and Rehabilitative Services, is a state agency. They are also our state unit on aging. So they provide policy and oversight. And then 24 of the 25 AAAs in Virginia are part of the Virginia Association of Area Agencies on Aging. So the directors of those 24 get together once a quarter and talk about statewide issues, policy issues, that type of thing that we want to advocate for. Okay. All right, so now taking a little bit more closer look at Arlington itself. We have 38,097 adults aged 60 and above who call Arlington home. That's a little over 16% of our population in Arlington, and we are projected to be around 20% by 2040. So the older population in Arlington is growing just like it is across the rest of the country. Okay, so this little chart here compares Arlington as a community to the Agency on Aging program participants. And what I like about this chart is it really highlights how we are able to prioritize the greatest economic need and greatest social need with the services that we're providing. So a couple that I'll point out, individuals who are at or below federal poverty. Arlington as a whole, 9.7%, but of the program participants in the Agency on Aging, it makes up 51% of our participants, okay? Looking at individuals who live alone, the percentage is a little bit closer, 48.6% to 59%. And then Arlington generally is We are a very diverse community, but we are, have a very high percentage of individuals who identify as white. But the individuals that we are serving, the majority is individuals who are, or it's a little bit closer. It's not a higher percentage, but it's a lot closer, the Black or African Americans. So we're 37% as opposed to 9% of the overall population that we're serving. Okay. Some other statistics that I wasn't able to squeeze onto this screen, right? So, looking at the Arlington as a whole, we know that, and that number is not matching up, but 15%, oh, I'm sorry, it is, because we have 15% of our individuals at or below 150% federal poverty level, but only 7% of those are collecting SNAP. Right? So 15% are eligible, only 7% are collecting SNAP. We know that 67% of individuals own their own home and 33% rent. Of those, 25% of the homeowners and 50% of the renters are cost burdened, which means they're spending 30 or more % of their income on housing costs. So we have 588 people receiving housing choice vouchers, and that's of the 60+ population. 483 receive a housing grant, and 869 receive real estate tax relief last year. Okay. This slide here, and I will send copies of the slides out to everybody after the meeting because some of them are a little bit of eye charts. I apologize for that. So this chart here just really highlights some of the programs that we offer through the Agency on Aging here in Arlington. So on the elder rights side, we have the long-term care ombudsman program. We also have the legal services. I listed it under supportive services, but we also have the legal services that we provide to individuals 60+. We do have caregiver services through consultations. We have some trainings, and we also have the respite program. In our nutrition programs, we have the social 60+ cafes at our 55+ centers. We have home delivered meals. We offer nutrition counseling and education, and we have our senior farmers market program. On the health and wellness side, we have the disease prevention, health promotion activities. Under the supportive services, the Aging and Disability Resource Center, the Community Living Program, which is our in-home services, our homemaker program. We offer transportation, the shoppers loops, and then a money management program. And then in the other category, we have our BICAP team, the Medicare counseling, and the senior Medicare patrol. Okay. And then looking at the fiscal year 2024, this chart here gives you an idea of the number of people that we served, unique individuals that we served, and the units of service that we provided during the year. And overall, we served 2,697 individuals through the Agency on Aging, and we offered 204,451 units of service. Okay, and a unit of service being an hour, a meal, a contact, a one-way trip. Okay, so in order to provide the services that are unique to our community, we have to identify what our community needs. Right? And so one of the ways that we do that is through our community engagement program. And so I have a few slides to give you a highlight of what we learned at this year's forum. So the theme was safe at home. We had locations at Macedonia, Culpeper, the Carlin, and through Microsoft Teams. The program offered a resource fair. We had the panel of experts. We had in-person breakout rooms at the 3 in-person locations, and then also sent the survey to everybody who registered and got some feedback through that. Okay. So highlights, we had about 114 people attend. 43 people completed the post-event survey. Once again, a majority were first-time attendees, 63%. What I really loved about this year is forever we've had high representation from white women aged 70 to 74 from 22207. This year, the majority of individuals represented were from 22203, and 45% of them identified as Black and African. So we shifted a little bit, and that was really exciting to me to see. 68% attended in person and 32% attended virtually. We asked 2 questions in the survey. The first one, what resources or supports do you need to help you feel safe in your home or community? And these were a few of the responses. So things like home modifications, buddy systems, and connection to younger neighbors were some of the interesting. Home safety checkups was another one. And then somebody mentioned connections and contact system for solo agers. And I think that's going to be a bigger representation of individuals that we're serving as the solo agers. And then the second question, what makes Arlington an age-friendly community? And of course, the first response is my favorite, that we have great staff, right? But also, you know, things that we're not surprised by, right? We are a small, clean, responsive community. We're safe. There's access to shopping. There's access to transportation. Neighbors look out for each other. There are opportunities for social engagement, and there is available resources, programs, and services. And then this is a real life chart. So like I said, I will send this out. I apologize again. But we've compiled this what matters most chart or information for the last 9 years. Is it 8 or 9 years? Yeah. And so, you know, I've kind of mapped out year by year. I've only included the most recent 5 years in addition to this year. But what we really, you know, see, no surprise, housing again, you know, is number one. Affordable co-living arrangements, housing modifications are all things that were mentioned. The second one is information and outreach. So, you know, as much as we try and we think we're getting information out there, there's still a lot of people that say, we don't know what resources are available. Okay. Let's see. And then also training on scams and aggressive vendors was also something that was mentioned. So I know Roland and Carlos, you guys are doing a lot on this training. You know, with the scams and everything. So keep up the great work. It's needed. Social connections was the next one. You know, people want that sense of community. There's an interest in intergenerational programs and opportunities to meet new people. Excuse me. Walkability was the next one. Sidewalk and crossing safety, proximity to shopping and transportation were all things that were mentioned, and then healthy living, access to physical and mental health care, dementia care, nutrition, education, and exercise. Again, all things that were mentioned. Okay. And then future topics. What other things do people want to see? And I did my best to categorize these, you know, but these are the things that were mentioned. So, you know, issues around legal concerns, right? So end of life planning, funeral planning, estate planning, emergency preparedness, health and wellness, caregivers, and then there was an other category, things like topics like modern racism, car and life insurance, transportation, were all things that were mentioned. Okay, so we have all of this that we now are going to bubble into the actual area plan document. So to create our area plan. So first of all, the area plan is a 4-year document that describes the programs and services that we're going to deliver in that time frame. We did the full area plan 2 years ago, but there were some regulation changes that forced DARS to update their state plan on aging. And so they asked us to do a full area plan this year. We'll do it again in 2 years, and then we'll be back on the 4-year plan after that, hopefully, right? Unless more regulations come down. So we take our inputs being, you know, some of the unmet needs, what are the trends, and what are the community needs and the data that we have, right? We also have required services. We have goals that the state prescribes in their state plan for aging. And then, you know, on that community data, we've done some projections on the demands. We know what our allocation is. Well, we know what the proposed allocation is. It's not a final allocation until the FY26 budget is passed. But we do have allocation information. I have on here allowable funding sources. Some of the sources of funds are very prescriptive. We can only use these funds for meals, for example. We can only use these funds for legal services or long-term care ombudsman, right? So we have to factor all of that in as well to the equation. And then, we do allow for public comment, both at this meeting, and we'll talk a little bit about it at the end of the presentation, but we will also have a 30-day public comment period. Okay, so we first of all have to start with what services are mandated. So CREA is the communication, referral, information, and assessment. There are care coordination, service coordination requirements. We have to offer options counseling in order to call our ADRC and ADRC. We have congregate and home delivered meals, nutrition education and nutrition counseling, caregiver services, transportation, the disease prevention, health promotion, legal assistance, the elder abuse and long-term care ombudsman, respite care. So it's a long laundry list of services that we're required to offer. And again, highlighting that the Older Americans Act requires that we identify and understand our population at greatest economic and greatest social within Arlington. Planning area has to understand. Okay, so we start here with the Virginia State Plan for Aging Services, and they have identified 5 goals that we need to align to. And so I won't read these 5 goals, but that the plan is out on the DARS website. I'll send a link to it, as well as these slides, like I said, at the with the follow-up information later today, probably. Okay. And then a couple other impacts on the federal fiscal year 2026 allocation. So first of all, Virginia received nearly $700,000 less this year in combined Title III, Title VII, and NSIP funds. And then the statewide losses amounted to $841,800 that impacted 21 of the 25 agencies on aging. Okay. Across the board, I think this is no surprise to any of us. The request for services is going through the roof, and the costs are going through the roof, right? And so, so lots of challenges to face. But there is a silver lining always, right? So a couple years ago, when we first developed, so 2 years ago when we did the main area plan, we had also been asked to create a new interstate funding formula, which directs DARS on how to divide up the allocation across the agencies on aging. And when we did that, there was a lot of concern about the change to the formula was impacting adversely some of the agencies on aging. So there was advocacy for funding to make sure that a hold harmless, if you will, right? So to make sure nobody lost too much money, right, which adversely affected their ability to continue services. So an additional $700,000 in state general funds was awarded to the agencies on aging to use for that purpose, right? So taking a look at which agencies on aging lost funding, and then attempt to not necessarily make them whole, but hold harmless. Then this year, there was also the additional $750,000 in general funds. So thank you again for your advocacy towards that. The original ask had been 4.3 million. And it will hopefully be on the General Assembly's agenda again this year. I know NVAN has it as one of their priorities that they will be advocating for. We're going to just have to keep pounding the message that the agencies on aging additional funding to keep doing what they need to do. Okay. We had anticipated, I think, if you remember last year, we talked about a significant reduction in the NSIP funds, and the NSIP is the National, Nutrition Services Incentive Program, right? So it is a program that is really focused on getting meals to people that need the nutrition. So we took a really significant reduction last year in these funds, and we expected it to be cut almost entirely this year. And so we were really happy to see that we actually got a slight increase in those funds this year. So that was definitely good news. And then the other good news is that if there is any carryover of federal funds at the end of the fiscal year, we are able to carry those over into the next fiscal year without any limit. Okay. I will say that those carryovers are getting smaller and smaller, right? So when we had the ARPA funds, right, we were carrying over a significant portion of our Title III funds, and those are quickly getting chewed up. So, okay. So here is our proposed allocation for federal fiscal year 2026. And I say proposed because the federal fiscal year 26 budget is not finalized, but DARS has sent out these funds. This is their best guess at how the funds will be allocated out. Okay. So total allocations are, if we sum up all of the federal and state funds, we're up 2% in our allocation. The federal funds, though, the Title III funds, there's a 2% reduction in what we're receiving, and that is the biggest chunk of our funding. Okay. The NSIP was up 42%, and then the general funds overall are up 6%. The OAA general, the reason that is up 33% is from that $700,000 hold harmless, because we were one of the agencies that was losing funding. And then our allocation of the $750,000. Okay, they put all of that into the OAA general fund because that is the fund where we have the most flexibility. And so therefore, we can use it however we need. So looking at the main categories of the programs, this is how within the area plan, I'm proposing that we spend those funds. So the first one we get to is our community living program, which is our in-home personal care, our homemaker program. And each of these charts, what you'll see is the service and the description, who our vendor is, how many clients we served in fiscal year 2024, and then what the proposed funding is for FY26, split out between federal and state funding. Okay. So with the homemaker, we have about 85,000 in Title IIIB and 70,000 in the general funds community-based bucket for our homemaker program. For our caregiver respite, which is also served through Home Care Partners, which is one of our homemaker programs, we have about $8,500 for that program. In our caregiver services, and this is provided through our nursing case management team and our adult day program, we're allocating about $101,000, just a little over that for that service. In our disease prevention and health promotion, the full allocation of $18,336 goes to that. This is one of those very prescriptive buckets of funding, right? So that is our allocation for that. Okay, so the next group, these are all the nutrition programs. So our home delivered meals program, which Jeffries is our vendor for the meals, and Meals on Wheels is our partner who does all the deliveries out to our recipients. We are looking at 186,000 in federal C2 funding, the 44,000 in NSIP, and that has to be used for meals. We'll take 14,000 of our OAA general, 50,000 of the GF home delivered meals, general funds home delivered meals, and 10,000 of the general funds supplemental nutrition. In our congregate nutrition program of the Title C1, which is the congregate nutrition bucket of funds, we'll use 86,128 of those funds. Okay. And then we also provide the meals for the adult day program that does count as a congregate program. So we'll use 23,000 of Title C1 and 12,000 of the general funds supplemental nutrition to fund those meals. And then last but not least, we have a small subsidy program over at Culpeper Garden to help individuals with the cost of their meal program. We allocate $40,000 of the general funds home delivered meals for that. So with the next bucket, we have our communications, information and referrals, which is our Aging and Disability Resource Center. We take 86,000 of our federal 3B funds, 63,000 in our OAA general, and the 57,000 of CCED. Okay. Legal assistance is 50,000 of our Title 3B funds. Our money management program is 20,000 of the 3B funds. And then our transportation shoppers loops is 17,360 of the 3B and 25,460 of the general funds transportation. And then last but not least is our long-term care ombudsman program. This is a partnership with Fairfax County. Fairfax County really runs the program. And the $1,835 that we get from in funding for the long-term care ombudsman goes to Fairfax County, and then there are some local dollars that go as well for that. So to pay our portion of the long-term care ombudsman. Okay, so that's an awful lot of information that I've thrown at all of you. Like I said, I am going to send the slides out after this. We are working on getting the full text of the area plan document out on the website so that you all can see the document itself. We were hoping to kick off the 30-day public comment period today. I don't think that's going to happen today, but it will be 30 days from when we can start, hopefully in the next week or two. We are going to have an online form, but also allow written comment and email submissions of any comments that you have to the documentation. Okay, so you'll have the slides, you'll have the area plan document, you'll be able to read it, ask questions, and provide any feedback that you have to what it is that we've mapped out here.
Speaking of asking questions,
Yeah,
does
now-
anyone have any questions? Carlos?
I have two questions. One under the nutrition meals program. What's Jeffrey's?
Jeffrey's Catering is the vendor that we contract with and I'm going to stop sharing just so I can see. That's the company that we contract to, and they provide our home delivered meals for Meals on Wheels, and they provide the meals for the congregate site and for the Catholic, for the adult day program.
And they also do that for Fairfax, is that right?
Yeah, Fairfax, City of Alexandria.
Yeah.
Yes, and then there's also a small part of it not related to the area plan, but they provide the meals at the RPC shelter on Columbia Pike to the day program that they're planning. So
The second question I have, and I think I know the answer already. So do we capture names, contact information, or any evaluation data from the SCAM workshops that Shell enrolled in?
so
I don't think we did.
I think we know the people who registered
Yeah.
for the SCAM programs, but I don't think we're capturing any other information on who participates in those programs.
That might be my last task that I do then. Evaluation pool. So the reason I'm asking, because these people are showing up, they're obviously concerned.
Mhm.
They seem to see the value of getting information out. They also seem to be like prime candidates for the ambassador program down the road.
Mhm.
That's why I'm asking the question.
Okay, no, that's good.
All right, okay, Kathy.
Yes.
Were there any changes in vendors in the plan? Are they pretty much the same as what they have been the last?
No, the vendors are all the same. Yeah, yeah.
But they are all selected usually through an RFP process.
Yes.
Yeah. And that's part of the reason we do this every year is that if there are changes, we add to the area plan. Were there any changes in how services are delivered, particularly because one of the state's goals is innovation? Just thinking about, and maybe that's in the detail of the actual written plan, which will.
Yeah, so I think,
Yeah.
one area is in the disease prevention health. Right, and that actually is a change in the vendor as well. It technically
Yeah.
a change in the vendor. So with that one, we've looked at and are doing a pilot program now with North Carolina State for the Eat Smart, Move More, Way Less program. It's a mouthful.
Yeah.
But that one, if it works out, if it works well, we buy slots to programs that start once a month, right? It goes for 15 weeks, but they're starting a new program once a month. So individuals can say, well, I'm going to be away for most of July, but September is a good time for me to start something like this, right? So they've got that flexibility. And it is provided through NC State. So we don't have to train somebody to offer the program. We don't have to worry about, do we have two people who are trained to, because a lot of the evidence-based programs require two facilitators and a lot of data collection, and NC State is doing all of that for us. So it feels like with as small as our staff is, it feels like a good plug and play option for to be able to provide this information to individuals, but not have that heavy administrative burden on the staff here. So, so that is one area. You know, and in all honesty, as we talk about the budget and what we're looking at, right, we're going to have to look really closely in FY 2026 at the home delivered meal program. Right, we currently deliver 10 meals a day, 5 days a week to individuals. But when we run the projections and the costs for that, it's going to cost over $500,000 to continue at that level. Okay, so I think we need to really start looking at, you know, we don't want to take away anything from individuals, especially the home delivered meals recipients, because they're some of our most vulnerable residents, right? But can we continue to pay, you know, that much for the home delivered meals? And, you know, that projection is factoring in a 3% cost increase when the contract renews in April. So, you know, that's just one of the areas I think that, you know, really we need to have some more conversation about. Yeah.
And I would also add for the other sort of how and what is changing is the federal requirements for caregiver services are changing effective October 1st. So some of those mandates are going to change a little bit. Fortunately, we're already doing a lot of the work. There are some flyers at the end of the table there, and we'll share online, but we're doing a memory cafe at Central Library. We also launched one in South Arlington at Walter Reed. And we've had some great outreach and just an ability to reach people we may not normally have touched in the past, having one in both North and South Arlington. So the caregiver services is going to change. And then the funding for CREA, that's a lot of sort of our outreach. It's how our Aging and Disability Resource Center sort of intake for all of our aging services in Arlington through some changes and then through a grant that we received through the National Council on Aging. We've been in the community a lot more, trying to reach people at AFAC when they're picking up their food, being in the community, affordable housing sites at the different 55+ centers. And then just again, continuing to work with our partners like Sparks, the 55+ programs, libraries, affordable housing partners, but meeting people in the community. And we've seen the numbers of who we're serving. So I think, Kathy, that's a great question. We really have to evaluate our how and who we're reaching, but also who we're not reaching.
Do we have any other questions? Yes.
And one small question.
I do.
Oh, hold on.
Claire
Oh.
on the phone.
Yeah, Claire, hold on, please.
Okay.
You mentioned the supplemental food budget for Culpeper
Yes.
Garden.
Yeah.
Why Culpeper, and there must be the same need everywhere?
So Culpeper came about because they have a meal program in-house, right? That used to be mandatory for the residents. Before my time, and I don't know if it was before your time.
No.
Go ahead. You let them talk.
Yeah, no. So Culpeper Garden in the past, it used to be a fee-for-service program. So anyone who resided at Culpeper Garden had to participate in the meal program. And Culpeper Garden is an independent living, but also assisted living. So for the independent living side, for residents who moved in, they had to sign up for a meal program. Well, for somebody on fixed income, it's really difficult, even if you're only paying 30% of your income towards rent, to pay the cost of the meal. So in the past, we offered a fee for service for those who met income requirements and were qualified. A few years ago, when they flipped over to housing choice voucher, when additional federal funding was awarded, that was something that could not continue. It had to be optional. So we went from sort of everybody being in the program to people having the choice of whether they want to be in the program or not. The program that they have now is very similar to kind of like a college campus. You can either purchase 3 meals a day, 2 meals, or one. And so residents have the choice of opting in or out. For those who do opt in, we still offer a little bit of a subsidy, but
It's only for those that are federal poverty. So,
but it is something we do follow closely because year after year, it's sort of dropped. And so looking closely at those numbers, having conversations with Culpeper Gardens leadership, the residents, of course, but it is one of the only independent living residences that actually has like a cafeteria in-house.
All right, good morning, Claire. You had a question?
Two very quick questions to Helen mostly. Since I'm on the phone, I didn't see the slides. Helen, I think you addressed scams, and I think someone talked about one of the commissioners that talked about scams. Is there a program, or is there, for instance, rental scams? Either if the person is in a rental apartment or in the process of maybe attempting to purchase something and things go off track. Is there a rental scam team or is assistance provided for rental scams?
so the scams, well, so let me get back to you on that one, Claire. I need a little bit more information on what you're talking about.
Yeah.
That feels like
Yeah.
something that, what maybe would fall into landlord tenant more than it would to the scam program. But if it's an actual scam, we can have the team. So Michelle Thomas, along with Roland and Carlos on the Aging Equity Committee, are the ones that are doing most of the work around the scam presentations. So you could connect with them as well.
Yeah, I will do
definitely
that.
Yeah.
And my
All right.
other question is in
Go ahead.
transportation, the Super Saver Senior Taxi will continue to be funded. Am I correct?
So we do not hold the funding for that program.
Okay.
The only participation in Super Senior Taxi that we have is to collect the applications and verify eligibility, and then we send that off to the commuter store. That contract is a very old contract. We actually touched base in with Terry Lynch, who, she was the Agency on Aging Director when that program started. We believe that Department of Environmental Services has the funding for that, but we can't find it. So we are still asking about that, but Super Senior Taxi does not fall into the discussion that we're having today.
Okay,
All right.
excellent. Thank you.
Thank you. So anyway, I want to try to fit in everyone who wants to ask questions. So
Yep.
Please raise your hand if you're here or online, and then I'm going to fit you in. Roland, you had your hand up?
Yeah.
Anyone else here? Okay. Anyone else online? All right. So Roland, go for it.
Helen, on the part dealing with the long-term care ombudsman program,
Yes.
there were 426 complaints. Were they formal complaints? What?
Yes, I believe they are.
Yeah,
Formal
and how
complaints.
does that operate? Is it individuals who file or complaints or?
It could be individuals, or it could be a group of individuals. It could be family members that call in. I think even staff could have the ability to call in and file a complaint. But yes, Fairfax County has the responsibility for that. For most of Northern Virginia, Prince William has their own, but for the rest of Northern Virginia, Fairfax provides that service for us. And so they have a staff of 6 or 7 people who, they have a hotline that you can call, you can register your complaint. There is an ombudsman, and then they train volunteers. So if anyone is interested in this, they're always looking for volunteers to be trained to, spend time within the community, talking to the residents and doing it's almost like a mediation kind of role within the community, working with the administration and the residents to attempt to resolve any issues that come up. So,
Great. Those type of programs are always good.
yes.
Do they give you any report at the end of the fiscal year as to types of complaints and?
Categories they will give us,
Categories,
but
okay.
not individual complaints. Yeah.
Great, thank you.
Just to follow up on that,
Yeah.
somebody from the ombudsman's office always comes to our long-term care residences committee and gives us monthly numbers of the of the county. We don't get facility-specific information. That's an issue. We've been discussing whether we can do that, but we do get reports every month.
Great.
I have one question for Rachel. You mentioned, at the executive, I believe, that Meals on Wheels is doing some fundraising. Do you call that? Yeah.
Yeah.
And that, can you tell us a little bit about that? And also, does their fundraising help us provide the meals? Deliveries?
It could,
Okay,
yes.
can you tell us a little bit about that?
Yeah, so traditionally, Meals on Wheels has primarily been funded by federal and state funding. We've been blessed that we've never had a waiting list in Arlington for Meals on Wheels, but as Helen mentioned, with the increasing population who need the service, as well as the increase in costs, we, for the first time, and thank you all for your advocacy, requested county funds, so local funding, and we were allocated $105,000 in this county fiscal year. So for the first time, the program received local funding. Meals on Wheels is a nonprofit organization. They are fundraising. You can kind of go to the Meals on Wheels Arlington website. I think one of the challenges that they've been working on, and they're an amazing team of volunteers primarily, is that sort of branding and identification. Meals on Wheels America is also housed in Arlington. And so one of the challenges is that sometimes when people go to donate to Meals on Wheels, they donate to the national headquarters and not the local chapter. But with some of the fundraising efforts, Meals on Wheels, Arlington is not only to provide the meals for the 60 and above population, their local fundraising helps to support individuals who are under the age of 60 with a disability, who also meet all of the eligibility for the program. So also kind of, I know there's such a great need, but there's opportunities to donate. There's also opportunities to volunteer. And Helen and I go out a few times. We do volunteer with them, delivering the meals. But again, I think this is something we're going to continue to look at. Alana on board back here with our registered dietitian, really looking at the options that we have while we prioritize the people of greatest need.
Great. And when you send out information with the slides, can you send us a contact at the Arlington Meals on Wheels so that if members want to volunteer, donate? I think I went to the national website, but and they are. I do want to give them. Go ahead.
Related to this, at the National Meals on Wheels America, they have been doing a lot of work around getting their members to partner with health plans, health systems, because they really feel that I think they say it's more than a meal. Yes. They're really helping people stay healthy, which ultimately saves healthcare dollars. And I wondered if the one here in Arlington is working on that, because that might be a broader conversation to think about another way to bring in additional funds beyond the fundraising and the federal dollars to get some private funding for this. There's this whole idea of contracting with, again, mostly health plans, I think, like Medicare Advantage plans, but also could be like even Virginia Hospital Center. Yeah, some of it can be under the not supplemental, but
the supplemental benefits.
Yeah, for the chronically ill. Yeah. So I think that's something that I want to explore, again, as part of that innovation, thinking about what else can be done.
Yeah, that's a great idea. And one of the things that the V4A, the Virginia Association of Area Agencies on Aging, has been advocating for, both with Virginia Medicaid, with DMAS, and then some of the social services. At the state level, Medicaid reimbursement for Meals on Wheels. And that's where we just haven't had the leadership support of that yet because it's a concern for cost. But Medicaid reimbursement, especially for having that meal, having the socialization, the connections with volunteers, does help people age in the community of their choice. So definitely some advocacy, but that's a great suggestion.
Super. Thanks for sharing all the information and your interest. And so Appreciate that. And Helen, thank you so much. You're the best. We could have waited, but wanted to do that. Could you please give her a round of applause? Thank you so much. That's your legacy. Speaking of which, there is a car going around. Please sign so that we can get that to Helen. So really appreciate it, Helen. That was great. Thank you so much. All right, next item on the agenda is approval of the meeting minutes. Does anyone have any questions, edits? If not, do you have any? Doesn't look like any. Do you have a motion and a second?
I so move.
Second.
Second, great. All right, all in favor of approval of the April 2025 meeting minutes, say aye.
Aye.
Any opposed? Right, the motion passes. Next, we are going back to Helen.
So I know you all are probably tired of hearing my voice, but I do just have a couple quick updates. So first of all, our nutritionist doesn't usually work on Mondays, so she has been with us since September. But she wanted to come today to hear the presentation. She's also part of the Food Security Task Force, which will meet this afternoon. So I wanted to introduce all of you to Alana Sullivan, who's hiding in the back. So Alana is doing an amazing job. She joined us in September, and she's just doing an amazing job connecting to our congregate meal participants, connecting to our home delivered meal participants. She's doing nutrition counseling, she's doing nutrition education, she's helping out with customer satisfaction surveys and anything else nutrition related. So we're super glad you're on staff, Alana, and glad you could make it this morning so everyone could meet you. So some of you know, I don't know if all of you know, Anthony Nunez resigned his commission position. So that means we have 2 vacancies right now, and we will have a third at the end of July because Carlos is rolling off at the end of July. He's coming very close to finishing a 6-year term. So Carlos, thank you for all that you have done. So 3 vacancies at the end of July. So if you know anybody who is interested, anybody who would be a good fit for the commission, please do encourage them to submit an application so we can start going through the vetting process. Okay. Our Aging and Disability Resource Center is just continuing to see demand and requests for services skyrocket. The number of requests for emergency shelter, especially in the last month, has been through the roof. And, you know, we are now seeing 2, 3, sometimes 4 requests a day to shelter. So that problem is not going away. It's not easing. And so, you know, we'll probably maybe in the future look to have tonight and do an update on. We are continuing our recruitment efforts in the Aging and Disability Resource Center to fill an open human services specialist position. I think we are very close and hope by next month to be able to make that announcement. And then my final update is about Senior Farmers Market, our most popular program that we have. They're switching this year from paper-based application and paper-based vouchers to a mobile phone app to both apply and redeem benefits, okay? So some of the benefits of that, right, is, you know, instead of being limited to $5, because that's how much a voucher is, you can spend to the penny, right? The downside is we have a lot of individuals who are not comfortable using their smartphones. So another thing that Alana has been doing is socializing this, helping people sign up already, you know, that type of thing. She's really doing a great job getting the word out. We've run into a little glitch though with the system that we chose to roll the system out with, in that individuals can apply now, that part's open, right? But the part where we can go in and view for eligibility and approve individuals is not yet available. Okay, so we are hopeful that in the next week or 2 it will be. But what we decided is that we would delay starting the program until June the 23rd. June the 23rd, we'll start accepting applications. We will start accepting paper applications on that day if we have to, right? So, but just spreading the word now that June 23rd is the day that we're going to start the program. And then, you know, I do expect that there's going to be a lot of questions and challenges, and the individuals who are not comfortable using the smartphone can request a debit card. And even the farmers this year are going to, instead of signing the checks that they used to, they are going to have an app, a mobile phone app, to scan the QR code either off of the app or off of the debit card for the individuals. So I expect there's going to be a lot of challenges this year. But you know, we're still offering the program. People are going to get $50 to spend at the farmers markets. And we've got enough funding to serve 750 people with this benefit. So we're doing our best to get it up and running, and we'll do our best to support the older adults through it. They can spend the $50 anytime between June 23rd and the end of November. So there is still time for them to spend it at the markets. It's just, we've got to be able to get in there to approve them before they can get started. So,
And just a quick point, like with the farmers market, we actually in Arlington have been accepting online applications since 2016. A lot of these big changes are from USDA. So they're federal changes that are kind of going through the state, each of the localities. So we have shared, and Audrey, I completely agree with your face the whole time Helen was speaking. We've shared those concerns with the state, and
numerous times.
yes, Helen has been a very strong and vocal advocate for our older adults and some of these big changes that we're seeing to the program. But we're committed to helping people enroll, and we know how popular this program is. We'll also be offering the seasonal grocery, the loops. So we'll be offering transportation primarily to the courthouse farmers market. That's from the people we hear from our older adults. That is their favorite market. We've tried different ones in the past and we've heard from them. So there'll be seasonal trips on Saturday to the courthouse farmers market.
Will there be someone at the farmer's market to help the older adults who don't have their approvals yet? Like, or don't know how to do it, to register them?
That might be a good conversation for the ambassadors, Wendy. But we will.
Yes,
we will-
no, I'm here. I heard what you said.
We can talk. I think first step is waiting for the launch, and getting the coupons out. But I think once people have it, we're starting the loops in July, mid-July.
We had originally planned to start it early July, but with this delay, we're gonna make it more mid to later July. But
that's something we can look at, and thinking creative with some of our partners, and then maybe with our benefits enrollment center as well. Yeah. Who doesn't love a property?
yeah,
All right, Helen, any more?
that's it for me. That's it for me.
Okay, any questions for Helen? And Rachel, please.
So I'll share some updates, both from my bureau and then from my Marina as well. But the first one is that this is Helen's last Commission on Aging meeting. So she is going to be dearly and sorely missed. I hope everybody received the flyer, but we are going to recognize Helen on Friday, June 27th at 1:30. We'll be in this room. If you did not get the flyer, please let me know and I'll share it again. But Helen has been such an amazing leader, advocate, director of the Agency on Aging and beyond. I probably won't be able to say more right now because I will cry. But Helen is going to be so missed. And I'm just so grateful that she is retiring in style, just how hard she has been working. This area plan is a lot of work. And I think, I don't know if it was William or Kathy who said, you know, this is her legacy, and it is. So she really has done such amazing work for Arlington, for older adults, for caregivers. And so, you know, come celebrate Helen if you are available. And if not, please make sure to just recognize her for everything she's done. So thank you to Helen. With that, we are in recruitment for the AAA director. We're hoping there won't be too much of an overlap. We did get permission to recruit prior to Helen leaving, which again just speaks to the importance of this role. And so hope to have some updates about that at our July meeting. Helen mentioned, our Aging and Disability Resource Center is in the process of recruitment. Actually, every department in our, every team within our bureau is recruiting. Our adult day program has 2 vacancies. We had 2 staff who have retired. And so because of licensing requirements, we're recruiting for that. One is sort of that primary caregiver role. The other is an aid for staffing and support. 2 clinical positions in adult services and adult protective services. And then our nursing case management has a vacancy as well. So we are actively recruiting across many of our programs. Helen mentioned unhoused older adults. It is a growing need. We're just seeing a lot of older adults who are in need of shelter. The shelter has been full the last few weeks. So we're working closely with some of our housing partners to try and be as proactive as possible to prevent evictions. But I think it was Thursday, the sheriff's office and sort of brought somebody to our office and said she was evicted, help. And so, you know, it does take a lot of advocacy, a lot of support, but there's a lot to unpack as well. All she had was a backpack of her items. So we're working with our shelters, our housing partners. We have had some wins with this, but there's a lot of work that we need to do more broadly as a community. I had the opportunity to present to our community planning and housing development last week. And so looking even at some of the intra-county partnerships that we can develop to address this growing need. But another way that we're addressing it is through our benefits enrollment center. I shared last year, we applied and were selected as a benefits enrollment center through the National Council on Aging. I think today we'll probably hit 600 people that we've served. A lot of that I want to recognize Tanae Young and the ADRC, who has really taken the lead. In May for Older Americans, Older Adults Month, we had our county older adults and caregiver benefits fair. We basically sort of covered this entire floor. We had about 23 different vendors, about 200 older adults who attended. Alana did some really amazing and fun cooking demos that were very popular. We were doing blood pressure screenings, vision screenings. Kate and VHC friends were here. Capital Caring did some robotic pet demos, and we actually gave away 6 robotic dogs, cats, and birds. But they're great tools for both pain management and for somebody with cognitive impairments. So we are through the Benefits Enrollment Center. We're really trying to address that gap that Helen mentioned of 15% of our older adults in poverty, yet only 7%, so about half, are accessing SNAP benefits. So some of the benefits for which they may qualify. But if anyone is interested in volunteering, please let me or Tanae know, and we'll connect you. We had the opportunity to visit one of the ambassador meetings and share with them some of the work that we're doing and ways we can partner. And then lastly, I think it was brought up at the executive committee meeting, but the Arlington County Fair is coming up. We will be staffing a table. Our director of communications retired, so information is a little bit delayed, but we will still have a presence at the county fair. We'll be staffing a table August 15th through the 17th, and connect with me or Michelle Thomas if you are interested in volunteering. We'll share more information as we receive it. I believe there's a meeting scheduled for this week, so we'll be sharing information once it's received, but please save the date. It's fun. We usually have a lot of people who attend, great conversations with older adults, with caregivers, and an opportunity to get a deep fried Oreo. So.
Okay, thank you, Rachel. And Al. All right, any questions for Rachel? Online? All right, thank you so much. So just a couple points. As you saw, there's food and shelter, right? I mean, Maslow's hierarchy. We need food. And so there are a lot of cuts to food. What can you do? Meals on Wheels, you can volunteer to deliver. Big part of it is social contact. So it addresses isolation when volunteers go and drop food off. So you can donate money to the website, Arlington Meals on Wheels, as Rachel noted. You can volunteer your time. I put my name on there and I gave $10, I think, so I'm gonna give more myself, but, please, you can do that yourself. You can get word out to your neighbors, go to your civic association. So, that's what you can do for food. Also, another item mentioned was NVAN. NVAN is out to advocate for, more funding, more things for, older adults. You don't have to be a commissioner. You don't have to be, anything really. You just join. If you want information, a lot of us around this table are involved. I think Erica is probably the most active person. Joan, anyway, so, you can get involved in that as well. It's all done via Zoom. So, we need your energy, your dedication for that. So thank you so much. And with respect to age friendly, I know you're all continuing to work on that, and I've requested, at the monthly reports to indicate what progress we've made on the specific items. If you're a committee member and you haven't signed on to any specific goals in your respective committee, take a look and talk to your committee chair, get involved so that we can keep the ball moving forward. So your work is greatly appreciated. So with that, we're going to move to, we're actually ahead of schedule. That's great. So, legislative, we have Roland on here. So did you want to give an update or is it Erica? So let us.
Well, the update would be a recommendation on what should be the legislative
Yes,
group. And I have to be honest, Erica did 105% of the work.
exactly.
So I think that Erica should really give the report. And
That's like,
the rest of us
that's
should,
a great
the rest
recommendation.
of us should sort of add to it.
Erica, please.
Well, thanks, William, for your suggestion at the executive committee meeting, that the members of the legislative committee get together and given the absence of Stephanie, given the absence of the chair, what should we do and what recommendations can we come up with? And so we got together and we brainstormed some ideas, and I want to thank in particular Charlie and Roland and Joan for their feedback. And what we are suggesting is that the commission chair would, instead of a formal committee with a chair, the commission chair would appoint two legislative coordinators who would work as a team. And one would be a commission member, hopefully one would be a commission member, if we can manage that, to best keep going with the commission. And those coordinators could convene an informal work group at their discretion, but it would not be a formal commission committee. The coordinators would be members of the executive committee, would report to the executive committee, would make sure that any legislative issues are on the executive committee agenda. And then, the recommendation went to all the functions. Why do we have an executive committee? How does it relate to NVAN? How do we track and manage the legislative process as well as through each year? So, we looked at all of those functions. So that's our recommendation, and we, yes, put it before you.
Thank you, Erica. Excellent recommendation. Do we have any questions, comments for Erica and the legislative work group? All right. Yeah, sorry.
On a similar note, the Housing Commission's Affordable Housing Ordinance Committee is moving ahead on updating the ordinance on affordable housing, which affects developers and the amount that they would contribute in either money or units. And that is going to require county board approval and then state approval. So that's something that's going to end up on NVAN's platform.
Okay. Thank you for the update. Next, we're going to go to Charlie for long-term. Oh, we'll consider it and follow up on that. Okay. So we're going to go to Charlie for long-term care.
Yeah, the long-term care residences committee met last Thursday. We focused a lot that we, besides our regular reports, on status of where we are in the law, on the age-friendly plan, and particularly two action items. One is, as you know, we have community advisory councils at a few of our facilities, and looking at the 3 freestanding nursing homes, we all originally had agreements to have the community advisory councils when they were first established back in late 70s, early 80s. And so one of the tasks in the plan is to ask the county attorney to do a little research to find out whether there are agreements that are enforceable today. Not that we would need to take particular action on them, but the nursing homes generally aren't really hot on the idea of community advisory councils. It's a lot more work on their part. So that's one thing that I've a request on behalf of the committee. William has it, Mamuna has it, and she'll review it, see whether we can send that along to the county board for a request. The other thing was actually in the plan, we have a action item to look into whether we get more specific complaint data from the ombudsman program. That's still under consideration. Looking ahead to the future, we have a July meeting at Culpeper Garden. We are trying to have every other meeting of ours at a different facility. And you all are invited to these committee meetings because when we do it at the facility, we generally get a presentation from the facility about what it's all about, and most of the time get a tour. So it's a good way to learn about these facilities in Arlington. So July 10th will be at Culpeper Gardens in the lower level big meeting room down there. And there's no meeting in August, but our September meeting will be at Carlin Springs Nursing Home on Carlin Springs Road, and that's September 11th. So if you have an interest in learning about these facilities, put that on your calendar. It would be helpful to let me know that you want to come because they like to know how many people they need to accommodate for these meetings. They have the room, but they need the number. Thank you.
Thank you, Charlie. Do we have any questions for Charlie, questions, comments?
Is there, yeah, I just have
Yes, ma'am.
a question.
Thank
Maybe two.
As many as you want.
What time? Because I would love to be at both.
Oh, they're at 10 o'clock. They go 10 to 11:30 generally.
Okay. Do they have a family advisory board?
They're supposed to. They don't. I don't think either of them have a very active one. They do have resident councils, but yeah, family advisory groups have been much harder for nursing homes to get off the ground and keep going. And I don't think the state particularly enforces that very strongly. They have to have one. I think their obligation is to be supportive of it. They're not.
Okay, I guess my main concern with family advisory board are for those residents who have no voice. That's my concern, because I was listening to a resident advisory board. Very, very good report. But the problem is, we're not talking about the one who is silent. Who advocates on those individuals' behalf? Family.
A lot of them don't have family.
Someone then we need to come up with some
Yeah.
kind of idea as how we can assist them in supporting their needs, because they do have needs, but they are not getting, I'm noticing they're not getting any assistance.
I would say before we even get there, we need to figure out how to identify
Yes.
those folks.
Right.
You know, like the silent ones are the ones that you don't ever hear or see of. You know, and so trying to figure out whether it's through the ombudsman program, whether it's through the social workers at the nursing homes, you know, the activities directors, figuring out who are the people that don't have anybody and who are the people that don't like come out of their rooms.
Correct. Yes, I agree.
Yeah, thank you. And this is great. These are all the LTC numbers. I'm so glad I joined the Cherrydale, so learned a lot and just have a lot of knowledgeable and passionate members like Peggy and Kristen and Charlie, of course, and Mamuna. So So great. Any other questions for Charlie? Catalina, transportation.
So there hasn't been a transportation committee meeting since the last, COA meeting, but our next meeting is on July 11th. And for the advisory group for Arlington's transportation future, the project team met, over the last several weeks with the planning commission and the transportation commission to socialize the latest draft vision and, goals. Which I've shared with this group before. There weren't many proposed modifications from the Transportation Commission or the Planning Commission. Just a couple word changes, but overall they recommended to move ahead with the statement, which I read last time, but includes reference to people of all ages, which I think was a nice addition from an earlier version. But for example, one of the changes the Transportation Commission recommended was changing a line that was in the sustainable goal that was about moving more people without more traffic to moving more people through multiple options. So there are certain pieces like that that the project team is going to discuss with us more at the next advisory group meeting, which is on July 16th. And then after that, they'll present the latest draft vision and goals to the county board at the July county board meeting. So that work is still ongoing, and I think the focus of the next meeting is on like 2050 planning, and eventually we'll start diving more into the actual policies and strategies, because the vision and the goals are still, kind of the 1,000-foot view. In addition to that, the committee is coordinating with a number of contacts that Helen provided, thank you, Helen, at the 5 different independent living residences to try to build on some of the community engagement and listening that we did last year with the Social 60 Cafe. So we're trying to sort of think through our approach, maybe refine it a little bit and think about the resident council meetings or the AFAC distribution days as potential ways to hear from folks. And then also coordinating with Mary Dallo from Vision Zero on a potential, community walk audit or mobility walk, I think is what they call them, so we can, again, just sort of understand the way that people move through a space, a certain sidewalk. We have to need to kind of think through the locations to hold that at, but she was saying that, we could make it like a public event and have folks come and, for like a mobility walk, they'll have walkers and other different devices so that people that don't normally use those could experience what it would be like on a street that doesn't have a sidewalk or doesn't have a curb cut. So it could help with the advocacy and understanding. Yeah, I think that's all for.
All right. Do we have questions or yes?
No, just like a comment. Thank you so much, Catalina. And I think that might be one that we invite JD Spain to in the past. And Link, I'm looking at you. I can't see you behind the collar. But when we did the walk on it a few years ago, Katie Crystal, who was on the county board at the time, joined us, and we sort of did this neighborhood. And I think that was a big factor of how they made the kind of intersection of by 7-Eleven more accessible. I think that was one of the areas we looked at on our walk audit, but it could be an opportunity to invite JD to attend as well. Thank you for that.
Super. Any other questions or comments for Catalina? So, Catalina, thank you for running with the ball. Really appreciate it. Also, thank you. Please keep us updated on the outreach to the residences and to all the committees. It's a good chance for you to, be a strap hanger on those. And if you want to just see how outreach is, and also to give information about your goals and what you're up to. So.
Yeah, thank you. I can share out the dates once we figure those out so that anyone else can join if you're.
Joan, I know you're an enthusiast on transportation. Any
Well,
thoughts?
I don't really have anything to add, but the Transportation Commission meets on June 26th. So I will be viewing their meeting. Thank you.
Thanks again. And just from the WMATA side, all the trains are going on automatic train operations, meaning computers are going to run it. There'll be an operator there. The goal is to run more trains through the system because computers are more efficient than people, and it's without having additional trains, so they can put more trains out. Also, there's a plan for, bus rapid transit connecting, Pentagon, Metro Station all the way down to Fort Belvoir. So there'll be limited stops on Route 1, that'll go there. And then I know I gave this out, update out last time as well, is, for Metro Access, there's an option, where people can sign up to use Uber. So you have to opt in, and there's a very high, satisfaction rate on that. So for the disability rides. Do you have any questions or comments on transportation? Okay.
I also forgot that Wilmota said the bus routes are all changing
Yes.
throughout the network. I think you mentioned that last time too, but June 29th. So I think for Alexandria and Arlington, it'll have like an A in front of it, and then similar for like DC and Maryland. So look out for that.
Yeah, not sure what Art has the latest, but it'd be great to get an update from Art as well. All right, Carlos, you're on deck.
So I'll make my report quick. I have to leave early.
Okay.
So there have been some disappointments, but some successes too, as I'll say it that way. One disappointment is that we had submitted a grant to try to roll out a smoking cessation program, specifically the African American community for older adults. That was under the Office of Smoking Health. Of course, this administration eliminated that office, so that is not a possibility. However, we quickly pivoted and requested funding through a different agency, and we were successful. However, it had to be DC specific. So we couldn't do it here locally, but we have rolled out the program. It's in the pilot test now, and we had our first session last week to an amazing success. It was amazing. Both Brenda and Mullen are part of that advisory effort. And so we're having a lot of success, but not in Arlington. Outside our control, obviously. Secondly, we were not successful in getting funding for 3 different grant opportunities to try to get this whole intergenerational online book club off. Part of it is that this administration destroyed AmeriCorps, and that was a part that we were really relying on to aspire. So we had to pivot, but we have another idea that I've already submitted one grant opportunity, and that is to create a storytelling hub for older LGBTQ older adults in conjunction with Freddy's as a hub for that, with a local storytelling group. And then Equity Nova was good enough to sponsor one particular podcast series that I organized. And now the whole idea is to capture those stories, perform them on stage in real time, and then capture the stories by recording them. So hopefully we're successful with this grant. But 3 disappointments, actually 4 disappointments, but pivoting to ways of doing things differently, given what we're facing right now. The SCAM sessions were very well attended, and I know that efforts will be underway to continue those, but I will create some kind of evaluation tool because I think that's critical. The mental health panel that was organized by the Arlington Community Foundation, I know Roland went, and you want to give a quick overview of that?
Yeah, it was very, very well attended. It was about 5 panelists here in Arlington dealing with the issue of mental health. As part of the Arlington Community Foundation did a community assessment, and they came up with certain areas where there's a need for more involvement by that foundation. And what they're doing now is they're specifically putting in place programs to deal with that need. This one on mental health was the first, pretty much, in that program. There's also a need where they're going to reach out to the senior community pretty much as well. So we're going to be working with the person from, at least I am, the Arlington Community Foundation, who's pretty much in charge of it. So there'll be more to come. Yeah.
What are they looking at specifically for older adults? Or do they need guidance on that? Because that actually is part of the health and wellness goals, is around mental health.
Yeah, they're looking for goals on that. For example, one big issue that came up in discussions was isolationism and the idea of not being able to get out and do some things socially. So that's one of pretty much the areas that they're looking at as well.
Okay.
So there's going to be more on that because that was part of their first meeting. And so I think their plan is to have several meetings during the course of the year with certain So.
And then, there have been some social events that have been getting people, the information out to some of our members, and some people have taken full advantage of that. And stay tuned for more stuff, because we don't have to always just work, we can have a good time too. So that's my report.
All right, thank you, Carlos. Do we have any questions or comments for Carlos and Roland? Online? Not? Carlos, did you say this? No, you'll be here next month as
In
well.
July, but online, right?
Yeah, okay. Well, I just want to say thank you so much for all your ideas and initiatives and energy. And so definitely hope that you continue to be here with us and join us at the alumni table or at anywhere you want to say. So online. Thank you. Much appreciated. Do we want to take a picture before Carlos goes, or is there a commissioners and Helen picture? You want to do that? Sure. Okay. All right, Carlos, 5 minutes, and alumni too.
We're taking a break.
Oh, you'll take the picture? Okay. Linda volunteer.
Yeah, I'll take it.
What's the best location over here, maybe? Or- You tell us.
Is this everybody?
Yeah, commissioners, please. Oh, you're the star. Okay, got it. All right. You gotta be balanced.
And there's another one here that we're talking
Yes, we're here. We gotta be balanced. We need more people on this. Let's save the clock for me with Nick to help. Everyone, welcome. You good? Is this good?
You want like a second row? We're you want like this and then you're gonna get a second row. Okay. Okay, second, make it second row.
So which is what it is.
This is totally off.
Okay. Thanks, Carl. Thank you. Yes. Kate, yeah, you are on deck.
Fantastic. Okay, so our health and wellness committee, and I apologize for looking down, I'm referring to notes that Kasha took and they're good, so I don't want to miss out. But our committee met May 16th. The purpose of that was really to talk through what we heard from Macedonia Baptist Church members, as well as some other action items that we have underway. So really covered off on kind of 4 topics that came up during that conversation, and we assigned some action steps within each area. One being looking at resources or assistance related to helping individuals better understand dementia, what that looks like, how to manage that. So we are in the process of reaching out to Sydney with RAFT, because they do host, as you know, a series of workshops. Might be a great connection for them to go back and provide that to some of the members and others in the community. Let's see, so that was one area. We also talked about nutrition information access. That was something they had brought up to us. And really tying that into, of course, overall health and addressing chronic health concerns. So, and during that conversation, we referenced the Eat Well, Move More program and how we might be of assistance to getting information out about that, perhaps pulling in members from the church or and others in the community. Even talked about Elena, I hope I said your name right. Alana, my apologies. And you know, again, bringing in the experts to deliver the information. Some other speakers were identified in there to tap into. And we talked about the markets, getting them information about those farmers markets. Medicare benefits and getting information about that prior to open enrollment came up. So we'll be, of course, talking with Michelle, how we can further that, maybe even tie it into a broader, community health fair in that neighborhood. And I think that was it. And then we talked in general about just how people get information. It may not be online. It may not be the ways that you and I get it. We may need to come up with different mechanisms, figure out, do we need to have things printed or face-to-face, or just what are the channels for getting information out? And it's multiple channels. It's not just one. So we talked about that as well, including the community ambassador program and getting somebody maybe tied in there to be a conduit. And Kasha was going to be reaching out to Pastor Harcum with some of these follow-up ideas and seeing where we are with that. So now our next meeting is July 11th. That sounds like a busy day based on everybody else's committee meetings, or at least that week. So that's where we are. Any comments or questions?
Thank you, Kate and Kasha. Thank you for running with the ball, and really appreciate it, and for the outreach. So thank you so much. All right, Audrey, Housing and Support Services, and Michael.
Thank you. As Audrey had mentioned, what's the name of the committee?
The Housing Commission's Affordable Housing Ordinance Committee.
That one. We're working on affordable housing.
I'm pushing, not making much progress yet, but I'm going to pretty much push some more. I'm not insisting, but that the ordinance includes something for affordable assistance, which we have not. And so the discussions have been about funding for the services, as you would expect. So if anybody has any creative ideas, the housing portion is fine because it's no different than any other housing, although it's a little more expensive. But how a company like Sunrise could handle the services, they like numbers that are predictable for 30 years, and the services are not. They vary with the amount of care somebody needs, which increases as the person gets older. And that has been the what's holding back affordable assisted living funding by developers. So if anybody has any creative way to solve that problem, whether it's the county picking up the services piece or whether we can somehow give developers a solid number, I don't know, but we're going to need to answer that question before I think we can really push it anywhere else.
Yes.
Is there a way that you could ask them to look at the rental portion and discount that?
Yes, and they're okay with that,
Okay.
but they don't want to commit to the services, and it doesn't help most of older adults to just pay the 4,000 or 5,000 when the services are another 5,000 to 8,000, 5,000 to 6,000. Depends on the amount of services they need. If they need 3+ hours of help, I mean, at that point they need to be in long-term care. But there's also the food involved, because that comes with food, where most affordable housing does not come with any other services at all.
Right.
So it's a lot cheaper. But the rent is okay. I don't think they want to step up to the rent without, but you're right, that's a compromise.
That's easy
Yes.
to deal with, and the food allocation could be similar. The care part is painful. It's always been a hard thing for health workers to calculate, and it's very expensive.
Right. And anyway, but you're right, I can push for at least the rent part.
I wonder if like different models of care would be something that they would be willing to look at. Like I know like by Village, they have like a set rate that you pay monthly, regardless of like high care, low care, you go in and this is the rate, period. As opposed to, because then there's more of a planning component for families.
But that'd be something that the affordable housing or assisted living places would have to do.
Yeah.
Not the developers. And there isn't one that they could partner with right now in Arlington, I think, that has a fixed rate.
And this is not really to your point, but the idea of like multi-generational housing, so that you have young families to be able to then offer support to older families and have it be a reciprocal relationship is, something that I think is a different way of looking at care. Cause like in DC, they have that, in Minnesota, they have that, and it's a way to sort of offset the costs a lot.
And we've mentioned it cursorily in the housing committee meetings, but it's something maybe we want to talk about more.
Yeah.
But I'm trying to get money out of developers,
Yeah.
just, you know. Bottom line.
Yeah. So as we're continuing to try to win friends and influence people, we are coordinating with the Disability Advisory Committee, because as most of you know, Housing Committee, we lean on universal design. The Disability Advisory Committee leans on ADA, so different but same but different. So we are working to collaborate with them a little bit on how we can help make change and progress here in Arlington together instead of separately. And then, as was mentioned previously, ARDC did their wonderful benefits enrollment fair back in May. So we had a great briefing by Tanae. I think Tanae's offline now. She was here earlier. They had over 200 participants in that event. So hopefully we can have that presentation done here for the whole commission, because it really gives some good insight on what they did, what Arlington County has to offer, because a lot of us, even in this room, forget that the resources are in place. We don't need to reinvent the wheel, and their outreach efforts were phenomenal. And over 200 participants in that event, which was very quickly planned. So we can get a lot of lessons learned from that team on how they do things and what we can take away from that. That is that.
All right, thank you, Michael. Any questions or comments from Michael?
All right.
All right. All right, thanks so much. So next is liaison updates.
Jennifer had to leave early, but she did post updates from the 55+ programs. So first of all, Arlington Mill has a new 55+ director, Mona Farah. Mona previously served as the Social 60+ Cafe Program Coordinator at Walter Reed. So now they have an opening at Walter Reed that should post on Friday. And then also from the 55+ program, Langston Brown's 60+ program coordinator, Cindy Leva, retired last Friday. She was 32 years with the Department of Parks and Recreation. I think it was less than that as the Social 60+ Cafe coordinator, but regardless, she was with us for quite a while. So they did hire a new coordinator. He goes by Daniel Bernal, started on June the 9th. So there was a little bit of overlap with him and Cindy, but he's in place now, and the reports are all good. I think Alana, you met him, right? Yeah. So, and then Wendy, did you want to give your update?
Sure. Much like Helen reports for the county, we're seeing an increasing pipeline of prospective members. We're up to 470 members right now. Continuing, 43% of them are lower income. Our challenge, as it's been, is to find more volunteer drivers. We're disappointed that we can't fill every ride. Every day, the day before, we still have, 2 to 4 rides that aren't filled, and we're dialing for drivers and sometimes aren't able to make the connection. So much like everyone has said, looking for more volunteers, looking to get more people engaged, looking to get everybody to do more.
Thank you, Wendy. Do we have any questions for Wendy? Do we have any other liaisons and updates? Yeah,
Just for age friendly, I think we're due for a meeting. We haven't had one in quite a while, I think since earlier this year. And I'm gonna check in with Cindy, see if we can get something done before the end of, get something scheduled before the end of July. I think there's a lot of alignment and so kind of meeting again to share where we can work together and get updates from each other. We get updates here, but kind of share a little bit more detail during the meeting. So I'll be back in touch with the chairs of the committees. Okay.
super.
If I, William, just, I forgot something I wanted to mention related to Helen's presentation. We are exploring some solo aging courses from different providers. We've looked at one that Dorot, D-O-R-O-T, provides nationwide out of New York. We're going to explore one that Iona Senior Center provides. So as we sort of explore these solo aging classes, we'll come back to you all when we think we've found one that really sings, and try to both use it for A and V and for a wider audience. But it's an ongoing project, so I just wanted to put it on our radar screen.
Thank you, Wendy. Any other questions, comments, before we adjourn? Go ahead.
Just one other, I just wanted to let people know, I think
Yeah.
you've attended some of the long-range planning committee meetings. I attended one in May,
Yes.
that was sort of open to the public or open to commissions and civic associations. It was very well attended. And this is to get input onto this long-range planning committee, a long-range plan for the county that really, if I understand this correctly, and please chime in, it's supposed to be like an umbrella plan for the county that pieces of it will impact all areas. If you go to the website, you'll see this big graphic of all the areas that this plan is touching right now in terms of thinking ahead, 25 years, really. So it's pretty cool, but like I said, there was great attendance at that meeting, lots of input, definitely accessibility, living in a community for all ages, so it was pretty good. I think there are gonna be other meetings, so, yeah.
No, thank you for raising that, and we can share that in the meeting follow-up about, it's the county's comprehensive plan, and some staff, we had a chance to, when they posted the initial kickoff event, but advocacy to elevate the needs of older adults and caregivers, especially with a growing population of older adults, so any opportunity to weigh in, whether in person or submitting comments about the plan. But thank you for raising that. We can share more information with the meeting follow-up.
That's super. Thank you, Kathy. Chuck?
Just a process question to clarify, about, the proposal Erica made about how we handle our legislative advocacy. And I ask this now because we're really, this time of year, the NVAN is in the formative stage of organizing how it's going to do this advocacy in the next session. So we really need to have something in place. What is the timeline in the process for making a decision of how we're going to handle that?
The legislative proposal, I think that could be pretty quick. So,
I mean, do we need a commission vote? Is it an executive committee vote? Or?
we don't need a commission vote, but I'll follow up with Eric on that. I mean, it looks like an excellent proposal, and I will discuss with get any input from DHS, and I think we could execute.
Okay, good.
Good. All right. Any other old business, new business, or announcements? Thanks, everyone. Really appreciate it. Thank you for a great meeting, and please take some action items. Take care. Where's it at? Has everyone had a chance to sign?
Yeah.
Charlie.
Formal presentation.